Hi guys, good afternoon. Am I audible and visible, everybody? Okay, so I hope you all are doing good, and we are almost towards the end of the session, guys. Somebody asked me to make a video on health programs, so I've already shared the video on health programs with the update. You can definitely follow that. Now today we're going to have a very quick session. I have brought all the PYTs from these, all the PYQs and PYTs from these respective topics. So we'll try to wrap up it in 45 minutes, 50 minutes, okay? You just keep answering and just keep revising these shorter topics, from which you can expect from all these topics combined 3 to 4 MCQs. FMGE exam may be, NEETPG exam may be, these are equally important, guys, alright? So let us begin. The first question, so we have done all of this. Yeah, I just wanted to update you. 13th ko we won't have formula and numericals. This is going to be on Monday, guys. 14th we are going to have formulas and numericals practice. Tomorrow I'm not there, so 14th I'm going to take up formulas and numerical practice. Okay, now arrange the steps of disaster. Can you quickly put in the comment section? Arrange the steps of disaster. Oh, I didn't send the PDF. I forget to send the PDF. 1 second. Okay, so I've sent the PDF on the Telegram group. Please have a look at it. It's the unannotated PDF. Okay. Alright, what you're answering, basic questions है आज सारे 2018 में आया था. Most of you are answering A. So of course it is impact, response, rehabilitation, mitigation. Please remember, mitigation is a step before disaster strikes. We start the disaster cycle from disaster impact. Let me show you the cycle once. This is your disaster cycle, guys. Impact होता है, उसके बाद 3 R होता है. Response, recovery, rehabilitation. Response, recovery, rehabilitation. The 3 R's, okay, reconstruction. Alright, reconstruction. Then you have development, mitigation and preparedness is before disaster strikes. Before disaster strikes, alright. Mitigation and preparedness. Mitigation is like preparing, prevent hazard from becoming a disaster. So most of you got this question correct. Today you will see all the PYQs from these topics, so please don't make any mistake, okay? Try to avoid making mistakes. Second question from disaster. Now I have given you an assertion that WHO recommends typhoid vaccine for disaster management in endemic areas. Reason: vaccination is a cost-effective way of disaster control. What do you think you are going to answer with this? Option A, B, C, D. Read, अच्छे से सोच के आंसर देना, guys. Please think carefully and answer the question. What is the answer over here, guys? WHO recommends typhoid vaccine for disaster management in endemic areas. Wherever the areas. Assertion, most of you are writing assertion and reason are true, and reason is the correct explanation of assertion. So I'm yet to get a correct answer for this one. Now this is just based on your concept, guys. It's a conceptual question. So just a couple of you got it correct. बच्चे, see, wherever it's a disaster endemic zone, let's say कोई जगह है जहाँ पे earthquake के chances हैं, या volcanic eruptions हैं, या drought, या flood, do we start vaccinating everybody with typhoid vaccine? No, it's not a cost effective measure, guys. WHO doesn't say, it doesn't recommend typhoid vaccine for disaster management in endemic areas. No, WHO says that health professionals who are working in disaster endemic zones, all right, health professionals who are posted in disaster endemic zones, all right, disaster endemic zones, जो हमारे health professionals होते हैं, we must vaccinate them with all the vaccines, okay? All vaccines given would mean typhoid, cholera, tetanus, hepatitis hepatitis, all vaccines given, guys, except which one you're not going to give? Except measles, because measles vaccine everybody would be given only to children. Are you understanding? So WHO क्या बोलता है? For health professionals who are posted in disaster endemic zone, all or disaster endemic areas, all vaccines would be given, except which is not given, guys? Except measles. All right. But post disaster, what does the WHO say? Post disaster, most commonly reported infection is GI. That doesn't mean I'll start vaccinating everybody yellow typhoid, yellow cholera, yellow hepatitis A. Nahi. Post disaster, all vaccines are contraindicated. All vaccines are contraindicated except measles. And measles, that too you're going to give to whom? You're going to give to children. Alright, you're going to give this measles vaccine to whom? To children. And you all know why have we selected measles? Because the seroconversion rate of measles vaccine is faster than any of the other disease. The seroconversion rate is faster. That means natural incubation period of measles is 10 to 14 days. After we give the vaccines, antibody starts forming within 7 to 10 days itself, guys. So जब तक की signs and symptoms आएंगे उसके पहले vaccine antibodies बना देगा, तभी तो it is protective, right? And if you are giving measles vaccine, you should give measles vaccine within 3 days of exposure. All right, measles vaccine to be given within 3 days of exposure. To be given within 3 days of exposure. All right, to be given within 3 days of exposure. Please don't forget these lines. All right, the first one is, in disaster endemic zones, all vaccines are contraindicated except measles, which has to be given within 3 days of exposure. Alright, and for health professionals, you need to keep them safe with all the vaccines except measles. Bye bolo. Hi bolo. Bye bolo. Bye bolo. Bye. Bye. I'm joking. Okay, so just give me 1 second, guys. So what is the answer over here? Assertion, it is false. What about reason? Reason is also false. So the correct answer is both are false. ठीक है, रीजन क्या बोल रहा है? वैक्सीनेशन इज कॉस्ट इफेक्टिव वे ऑफ डिजास्टर कंट्रोल? नो, इट इज नॉट अ कॉस्ट इफेक्टिव वे ओवर हियर बिकॉज इट्स नॉट गोइंग टू ऑफर यू दैट प्रोटेक्शन. एम आई क्लियर एवरीबडी? ठीक है, एम आई क्लियर एवरीबडी? डिड यू गेट दिस क्वेश्चन? चलो, लेट्स गो टू द नेक्स्ट वन. सो गो टू द नेक्स्ट वन. आई विल जस्ट कम इन अ व्हाइल. चलिए को सबको बाय करो. बाय बाय. चलो, आंसर क्या है? पेशेंट्स रिक्वायरिंग इमीडिएट लाइफ थ्रेटनिंग केयर, ठीक है, आर कैटेगराइज्ड अंडर विच ऑफ द फॉलोइंग triage? Oh, he will not let you study. He is very naughty boy. He will keep, he'll try to. Yesterday he started a live class. I was not here and the laptop was on. And on YouTube you can see that schedule stream. He went there, I don't know how he clicked that schedule stream and live class started and nobody was here. Then I got a couple of messages. I was like, live class still going on, but I have ended it. So he's very naughty, my daughter was very, like, wherever I used to make her sit, she would sit. But yeah, no, I don't know what he does all the time. Is jumping. Chalo. Okay, let's go to the next one. So what have you answered, guys? Option A. Very good. Patients requiring immediately life-threatening care are categorized under option A. Yeah, you joined? Okay. So that is red. ठीक है. Now immediate life threatening care, all of you have to remember the triage, guys. So let's quickly talk about the triage. The first one is red color, the second one is yellow, or you could also say blue. The third one, everybody, is the green color, and the last one is the black color. So red color will be the high priority, highest, whatever you want to say. Okay, 0 to 6 are immediate resuscitation, limb saving surgery, hemothorax, pneumothorax, all these will go under red color. Then you have yellow or blue. Please remember, this is medium. उल्टा मत कर देना, highest high, वो गलत है. High, highest is red, blue or yellow is medium. So that is 6 to 24 hours. Like you have stabilized the fracture, they can wait for the surgery, that is it. Green, everybody, is low priority. Okay, they are ambulatory, they are moving about. And dead, of course, black is the least priority. They are dead, moribund, likely to die, dead or moribund. And guys, how do you do this triage, everybody? How do you do this triage? This categorization of the victims that we do is done basically on the likelihood of survival, on the likelihood of survival, more chances of survival, and of course severity of injury, severity of injury. But we are more focused on likelihood of सर्वाइवल. कोई स्टूडेंट ऐसे मत करना हाईएस्ट हाई, वो गलत है. हाई हाईएस्ट, इनफैक्ट पार्क टेक्स्ट बुक ओनली मेंशंस हाई, देन मीडियम, लो एंड लीस्ट. Clear, everybody? 6 to 20, well, like you stabilized a fracture, okay, and now they can wait for the surgery up to 24 hours because you've stabilized the patients. Clear? Reverse triage, yes, reverse triage is in war settings where we kind of give preference to the green color. Okay, reverse triage is in war setting. Reverse triage is during war, or it is also during military settings. Okay, it is also during military settings. जैसे जो less injured है, we are going to cater to them first and send them back to the fields to fight because the situation is of war. Clear? Going to the next one, in Kerala after flood, people are complaining of fever. Doxycycline is distributed prophylactically. Which insecticide is preferred alongside? Most of you had a doubt in this question. I thought I'll discuss it once. In Kerala after flood. Now see, after flood, or we all know that most common disaster reported in India, most common disaster in India, everybody, is hydrological disaster. Okay, hydrological disaster. That's the most common. And the most common infection reported post disaster, most common infection पोस्ट डिजास्टर सबसे कॉमन इन्फेक्शन जो रिपोर्ट होता है ना, वो होता है जीआई इन्फेक्शन, टाइफॉइड, कॉलरा एंड ऑल दैट. बट जूनोटिक डिजीज ऑल्सो कॉमन, जूनोटिक डिजीज वेरी कॉमन, जूनोटिक डिजीजेस वेरी कॉमन. इन जूनोटिक डिजीजेस द वन विच इज मोस्ट कॉमन इज leptospirosis. You all know leptospira interrogans is released in rat urine. So leptospirosis is associated with rat rains, rice fields. So what does this mean? To control the rats, should I start spraying a rodenticide, zinc phosphide? No guys, it is highly toxic. We only spray zinc phosphide in the burrows, alright? We can't start spraying it like this. ठीक है. So the insecticide that we are going to spray over here again is we are going to stick to malathion to control vector-borne diseases. All right. Now Paris green, of course, that is an anti-larval measure. Zinc phosphide की जगह it is toxic. Okay. So because of that we are giving what? Doxycycline. Next time they can give you a question prophylactically. What should you do? So prophylactically you should administer doxycycline to the victims. Clear? So vector-borne, one more point, remember, vector-borne diseases take time to appear post disaster. Vector-borne diseases take time to appear post disaster. vector-borne diseases को time लगता है post disaster आने में. Example, dengue, malaria. You can never see Kala Azar post disaster. You all know that vector-borne disease में it is Kala Azar also. काला आजार कभी पोस्ट डिजास्टर नहीं दिखेगा. काला आजार और विसरल लीशमेनियासिस you don't see because its का incubation period could be from weeks to months to years. So काला आजार is not seen post disaster. ठीक है, one vector borne disease which is not reported, not seen post disaster. All right, ये छोटी छोटी चीज़ें आपको पता होनी चाहिए. That's important. Going to the next question, guys. What is the answer to this one? Can you all give me the answer to this quickly? Today we are little short of time, guys. Have you written? ओके, लिंडेन इज बेंजीन गामा हेक्साक्लोराइड. यहाँ लिख देती हूँ लिंडेन. गाइज, एनीबडी हु डजंट नो व्हाट इज लिंडेन? लिंडेन इज केबीज वगैरह के लिए यूज हो सकता है. बेंजीन गामा हेक्साक्लोराइड. ओके, लिंडेन इज यूज फॉर ऑल some kind of scabies हो गया, itchy infection, hexachloride. ठीक है, that's mostly for scabies. All right, what does recovery phase consists of? Response and rehabilitation. So I'm not going to discuss this, we've already discussed it. Okay, recovery is not prevention, mitigation. That is before disaster strikes. Going to the next question. So you can see recovery and rehabilitation like that comes after disaster. Okay, next question. Post disaster cycle, a phase of disaster cycle before disaster impact. 2018 question. Before disaster impact, what is it? What is it, everybody? Before disaster impact, mitigation and preparedness. Lot of questions turning from mitigation, guys. So remember, mitigation का मतलब होता है prevent hazard from becoming disaster. Prevent hazard from becoming disaster. And in mitigation, guys, me and you, we can't do anything. We need engineering modalities. All right, we need what modalities? Engineering modalities. Engineering modalities का मतलब जैसे make the dams flood resistant, don't let water collect, fill all the open drains, वो होता है mitigation. इसको बहुत आज make the buildings earthquake resistant. ठीक है. Okay, true about triages. Least priority is given to ambulatory patients. Least priority is given to morbid patients. First come first treated basis. 3 color coding system is used. 3 color तो है नहीं, 4 color है ना. So least priority is given to morbid patient. Again remember, high priority, medium priority, low priority, least priority. ये आपने याद रखना है, these priorities. Clear? Okay. Next one, let's come to health, education, communication. Disaster is over. A hand washing session was conducted in a community. The correct sequence of events is, what is your answer here? Very important, the ITA cycle. You remember the ITA cycle? Good. So that is awareness, interest, evaluation, adoption. Now remember, communication cycle क्या होता है? There's a sender, frames a message, goes via a channel to the audience. Audience मतलब तुम्हारा receiver है, और receiver से हम लोग लेते हैं feedback, always feedback, and we send it back. Now how will the receivers accept everything? अगर मैं किसी को बोलूँ vaccinate your children, they don't listen. You have to make it interesting. So always remember, there is a motivational model which helps you do this, guys. The message should generate an awareness. It should be interesting. All right, and then it should motivate you. ठीक है, मोटिवेट करना चाहिए, फिर आप उसको इवेलुएट करोगे, एंड लास्ट बट नॉट द लीस्ट यू आर गोइंग टू अडॉप्ट इट. ऑल राइट, यू आर गोइंग टू इवेलुएट के बाद यू विल गिव अ ट्रायल ऑल्सो. ट्रायल एंड देन अडॉप्शन. AIETA, ITA, अवेयरनेस, इंटरेस्ट, इवेलुएशन, ट्रायल, अडॉप्शन. सो दिस इज वेरी वेरी इंपॉर्टेंट क्वेश्चन. ठीक है. Okay, India is a diverse community with a wealth of different cultures and languages. Correct statement among the following is, what will you answer over here? जैसे अगर मैं बोलूँ evaluation, Dr. Pratiksha, vaccinate your children, okay, you won't immediately start doing it, right? I will show you video that will make you think really I should vaccinate my children, otherwise something will happen. So evaluation is like giving it a thought. It's a long term process, it comes gradually, okay? You'll evaluate, you'll try it, then only you're going to adopt it. That's the meaning of evaluation here. Okay, physician should not emphasize much on the communication. He should always treat the patient regardless of patient's perception. Never. You cannot. You have to respect his culture, his thoughts, his ideologies. Leave communication to the interpreter. No. Even if you have an interpreter, you have to try. So what is it? Due emphasis should be given to patient's cultural background. Otherwise, it will become a barrier. कल्चरल बैरियर हो जाता है, विच इज़ वेरी वेरी बैड. ठीक है, यू करेक्ट ये नहीं है. डोंट थिंक ऑप्शन बी इज करेक्ट. ट्रीट द पेशेंट रिगार्डलेस ऑफ पेशेंट्स परसेप्शन. नो, यू ऑलवेज हैव टू कंसिडर व्हाट द पेशेंट इज थिंकिंग, व्हाट इज ऑन हिज माइंड, व्हाट ही अंडरस्टैंड्स. ओके, डोंट मेक अ मिस्टेक देयर गाइस. Moving to the next question, everybody, all of the following statements about health education are true except. Now there's a very common, this is a common 3-star topic, health education or health propaganda में difference. बताओ, would you want to be affected by education or would you want to be a victim of health propaganda? Propaganda मतलब क्या होता है? If I say somebody let's go and beat someone, if he or she is under the effect of propaganda, they'll say okay, let's go. But if you're under the effect of health education, you'll say why should we do that? You're going to think. So if you talk about health education, guys, it appeals to reason. Yes. It is behavior centered. Yes. It aids in developing reflexive behavior. No, it aids in developing reflective behavior. It will help you reflect. ठीक है, it disciplines primitive desires. So we've done this topic many times. You must go through this thing, guys. Education reason पे अपील करता है, propaganda emotion पे अपील करता है. Education is behavior centered, propaganda everybody is information centered. Okay, so these are the differences between health education and health information. Don't mess this up. ऑल राइट, इंटरनलाइजेशन, एक्चुअली ये भी PYQ ही है गाइस, पहले आया था. एक हेल्थ एजुकेशन का एक मॉडल होता है जिसमें इंटरनलाइजेशन आपको करता है. व्हाट इज दैट? द थिंग दैट यू सॉ, आइटा, is actually a part of this model. Which model is AITA a part of, guys? Which model is AITA a part of? AITA is a part of जो अभी देखा, okay, awareness, interest, evaluation, trial, adoption. AITA is a part of motivation model only. In motivation model, internalization occurs. What is internalization? We adopt a healthy behavior and try to make it our own. ठीक है, internalization is आप कुछ healthy behavior adopt करते हो and you try to bring it in your daily life. Okay, so that is internalization. Internalization, AITA, everything is associated with motivation model. Okay. Moving to the next one. Can you tell me the answer to this? A discussion was, yeah, adopt someone's behavior. That also you could say. Good. Read karo isko, guys. Not the bad behaviors. It's to adopt someone's healthy behavior. Okay, what is the answer to this one? Are you writing? Why have I not got any answer? Lokendra has come up, Tanishka has come up. A discussion was conducted among women residing in an urban slum to discuss the issue of domestic violence. All the statements regarding this type of health communication technique, FGD, focus group discussion. Now guys, remember one thing. See, there are ways to collect data. It could be quantitative, it could be qualitative. Quantitative होता है questionnaire fill करा लो, ठीक है. Qualitative होता है where I don't have open-ended, I don't have closed-ended questions. जैसे आपका exam close-ended है, you get options A, B, C, D. In open-ended questions, we just give the questions. We don't have any options. They can say what they want to say. Okay, so FGD for sensitive issues like domestic violence, this should be your hint, addiction, ये सब में हम लोग ग्रुप डिस्कशन करेंगे. एंड योर बजवर्ड इन फोकस ग्रुप डिस्कशन इज इट इज़ अ डिस्कशन बिटवीन 6 to 12 members. Okay, they sit in a circle and they are discussing. ठीक है, they are discussing. You have almost 6 to 12 members. Also in between you have a moderator. Moderator क्या करता है? Guides the conversation because conversation. Remember, it's a focused group. You can discuss only one possible topic. If the discussion is on domestic violence, there are people talking, so they can start discussing something else also. So there is high probability of diverging from the concerned topic. We can start discussing politics, we can start discussing something else, children. Okay, so now what happens? But what is wrong? Does it give you an opportunity to discuss other topics? No, it's focused. Focused matlab you can discuss one topic. It's focused on one topic. You cannot resort to discussing any other topic. It does give you the opportunity. I mean, it doesn't provide you the opportunity. There are high chances. Clear? किसने लिखा था ये सारे सही? गाइज आपने लिखा हाई पॉसिबिलिटी ऑफ डाइवर्जिंग. दैट इज करेक्ट. वी कैन. दैट इज वाई वी हैव अ मॉडरेटर इज गोइंग टू गाइड यू इन द कॉन्वर्सेशन, ब्रिंग यू बैक टू द करेक्ट आंसर. ठीक है, इट डज गिव यू एन अपॉर्चुनिटी. तो नहीं देता ना, ये तो नहीं है कि इफ इट्स ऑन वायलेंस लेट्स स्टार्ट टॉकिंग अबाउट समथिंग एल्स. नो. नाउ इज इट क्लियर? एवरीबडी गिव मी अ थम्स अप. सी, द नेम इज focus group discussion. You're going to discuss one topic, but since it's people sitting in a together, they can start discussing something else also. Therefore you have a moderator who's going to guide the conversation. ठीक है? All right. How they diverge? Because they are humans, Lokendra. If I make you sit, all of you sit in a circle and make you speak about something, कुछ लोग तो होंगे जो कुछ और बातें करने लगेंगे. ठीक है? Human tendency. It doesn't give us an opportunity because it should be focused, but we start talking something else. That is why we have a moderator. Alright, there is a possibility. That's a correct way of putting Bhakti. Very good. Giving class in a village for wound care after dog bite by enacting it. Which mode? Very good. Demonstration. Remember, these are all two-way. Two-way का मतलब होता है Socratic. Okay. Lecture is one way, which is didactic. Demonstration believes in seeing is believing, learning by doing. Application of scabies ointment. इसमें एक और क्वेश्चन था ORS preparation. उसको भी हम लोग demonstration से कर सकते हैं. Clear? Next question. Workshop is. Now from this we're going to do a couple of more MCQs. Workshop. What is workshop? Remember the buzzword with workshop, everybody? Yeah, workshop is series of 4 or more meetings. All right, workshop is series of 4 or more meetings. What is the first one? 4 to 8 experts. 4 to 8 experts आपको symposium में भी मिलते हैं, panel discussion में भी मिलते हैं. Now discussion जब होगा in front of an audience, 4 to 8 experts, where the experts can talk among themselves, is a panel. Discussion between 6 to 12 members, buzzword, FGT. Series of speeches. 4 to 8 experts are giving series of speeches. It follows a set agenda, set order of speaking. ठीक है, all of that. So this everybody series of speeches. This is what? Symposium. This is what? Symposium. ठीक है, don't forget these buzzwords. All right, yeah, we've got the question here. This again is a PYQ. All are true about panel discussion except. What is your answer here? ऐसा क्यों रहा है? B, C, D. पैनल और सिंपोजियम, ठीक है, बोथ आर टू वे गाइस. Socratic audience definitely can take part. In panel, 4 to 8 experts discuss. In panel, just remember a news channel. People are discussing among themselves, so that is allowed. Audience, presenter audience can take part, but set speeches, specific order, set agenda, ये किस में होता है? These are all in symposium. It is not in panel. Clear? Okay, moving to the next one. What is the name of this image? Can you quickly tell me the name of this image, everybody, in the comment section? Something to do with one of the health communication techniques. Something to do with one of the health communication techniques. इसका नाम क्या है इस image का? Good Nas, good everybody. Actually, this is something which is drawn in a sociogram, drawn in a FGD. The name is sociogram. All right, sociogram. It reflects the quality of FGD, how interactive the FGD is. Okay, more the lines, the better. So right now you can just know this image name, sociogram, which is reflecting, of course, on the quality of FGD. Okay, now that was health, education, communication. Now we come to a couple of questions on planning cycle and health management techniques. Put out your answers, guys. Arrange the following steps of planning cycle in the correct chronological sequence. Now in planning cycle, always remember, okay, पहले तुम कर लो, then I'll tell you. I haven't got any answer yet. Am I not audible? Am I not visible? Why am I not getting answers? Okay, good. You took your time. I'm happy you took your time. Okay, now always remember, guys, ECA क्या है? हमेशा याद रखो, guys, plan करने के लिए, like you have to plan your studies, whatever you want to plan. The first thing that you will always do is analyze. Where am I lacking? What are the problems? And evaluation is at the end, which is being done in case for you NEETPG or FMG by National Board of Examination. The first thing is always to analyze. ठीक है, analyze करके we set our goals and objectives. ठीक है, so analysis is the first step. Alright, then what do? We analyze our goals and objectives. Okay, then what do? We analyze our goals and objectives. ठीक है, so सबसे पहले तुम्हारा ये हो गया, फिर तुम analyze करोगे goals and objectives. Then you're going to assess the resources. Then you're going to program and implement, and you're going to evaluate. So 1, 2, 3, 4, 5. Yeah, I think something is mixed up in the options. 4A, okay, that ways I have written it. Okay, so we can put it like this. 4, सबसे पहले it is this one. What we are going to do is, you can just follow this guy's situation over here that I have given you. Okay, so you can just follow this one. सबसे पहले analyze करोगे, last में evaluate करोगे. After analyzing, give your goals, assess your resources, manpower, money, material, prioritize what you'll do, plan, formulate, implement, monitor and evaluation. Guys, remember, communication cycle में evaluation, communication cycle में evaluation पहले होता है. You will evaluate and you will adopt in a communication cycle. But in a planning cycle, evaluation last में होता है. And evaluation is going to be done by an external body. Monitoring is going to be done by an internal body. Am I clear? Did you understand, everybody? Monitoring is every day. Monitoring focuses on the process. Evaluation focuses on the outcome. ठीक है, चलो, let's go to the next question now. Okay, disaster vaccination I will tell you. Quiet. Health management, goal का मतलब क्या होता है? What do you mean by goal? 1, 2, 3 बना दो. 2, 3, 4, 5. चलो क्या, बाय कर दो, बाय कर दो. नीचे से ले, चलो बाय करके फिर आना, ठीक है? थोड़ी देरी में घूमी करके आओ, जाओ थोड़ा सा खेल. बाय. ये दे दो बाय नहीं को. ऑलराइट, चलो. Now what is the question over here? Goal. Goal refers to the ultimate desired state towards which objectives and resources are directed. That is what is goal. Goal can be achieved or it will not be achieved. Please remember, goal is not constrained by, ठीक है, not constrained by time and resources, not constrained by time and resources, ठीक है. बट रिमेंबर ऑब्जेक्टिव्स, ऑब्जेक्टिव्स क्या होता है? ऑब्जेक्टिव्स होता है प्लान, स्पेसिफिक प्लान्ड एंड पॉइंट ऑफ ऑल एक्टिविटीज, स्पेसिफिक प्लान्ड end point of all activities, end point of all activities, that is your objectives. And targets होते हैं degree of achievement of objectives with time. Straight definitions आएंगे, degree of achievement of objectives with time, degree of achievement of objectives with time, वो होता है तुम्हारा target. Clear? जैसे your goal is NEETPG FMG, your objective is to do the revision in the next 7 days, your target is daily practice 50 MCQs, ठीक है. All right, yeah, time bound, smart. Now I would not say be very focused on these questions of health planning committees guys, ये old questions थे, फिर भी एक दो जो आ सकते हैं. I'm trying to make you revise. 3 million plan was proposed by as quick as possible. 3 million plan किसने propose किया था? 3 million plan was proposed by very good Sir Joseph Bohr. Bohr ने boring concepts दिए जैसे school health का, social physician का, all right, social physician का, and also he said 3 months training in PSM, okay, 3 months training in PSM. Kartar Singh gave the concept of multi-purpose worker, male and female, ठीक है. Mudaliar said Mudaliar was an IAS officer, so इन्होंने क्या दिया? Cadre of All India Health Services, All India Health Services, that's what Mudaliar committee did. श्रीवास्तवा में SHR है, actually श्रीवास्तवा पढ़ लो, SHR इसको रिवर्स कर दो, RHS. So RHS means Rural Health Service. He was focused on promoting rural health services, and because he wanted to promote rural health services, he also gave the concept of village guides, village health guides. Then RSA referral services, and also one more क्या है? ROM, reorient medical education, मतलब medical education OPD में बैठ के नहीं, field में जाना पड़ेगा. So just a couple of things I'm giving you over here, so quickly answer करो. Rural health scheme was introduced by Chadda committee was malaria and family planning. Rural health is Shrivastava, उसको just reverse कर देना. Just give me the name of 3 committees. Health planning and development, health survey and development committee. What's the name of which committee? हेल्थ सर्वे एंड डेवलपमेंट कमेटी. कौन सी कमेटी है? हेल्थ सर्वे एंड डेवलपमेंट कमेटी. एक्चुअली कौन सी कमेटी है? हेल्थ सर्वे एंड प्लानिंग कमेटी इज एक्चुअली विच कमेटी? कैन एनीवन टेल मी? हेल्थ सर्वे एंड प्लानिंग. सो वेरी गुड. हेल्थ सर्वे एंड डेवलपमेंट इज बोर. बोर वॉज अ वेरी एम्बिशियस मैन. ही वॉज टॉकिंग अबाउट डेवलपमेंट बिफोर इंडिपेंडेंस. Mudaliar came and said, first please plan things. So health survey and planning is Mudaliar. What about committee on integration of health services? Committee on integration of health services, ये कौन सी कमेटी है? Committee on integration of health services. Integration of health services का मतलब क्या होता है? Promotive, preventive, curative, rehabilitative services, everything together. Yeah, it is Jungalwala committee. No private practice for doctors, equal pay for equal work. So that is committee on integration of health services. Next question guys, health management techniques. All of the following are included in methods based on behavioral sciences except Bhumi, I think I've shared flashcards for committees, but I will do it once again. हाँ, इसका मेरा एक वीडियो देखो, मैंने न्यूमोनिक के साथ पढ़ाया है ऑल द कमिटीज़. यू विल फाइंड इट ऑनलाइन ऑल्सो. जस्ट राइट माई नेम एंड राइट हेल्थ कमिटीज़. You will get it with mnemonics, guys. Okay, so what is the answer over here? All the following are included in methods based on behavioral sciences. Okay, Pokemon, that's correct. Pokemon. So P is personal, let me write it here. P is personal management. P is personal management. O stands for organizational design. O stands for organizational design. ठीक है. C stands for communication. C stands for communication. I stands for information system. Information system. And तुम्हारा MON stands for management by objectives. Management by objectives. ठीक है. So over here, which is the one we are left with? Systems analysis. ठीक है. बहुत सारे बच्चों ने, कुछ स्टूडेंट्स ने C मार्क किया है. प्लीज रिमेंबर, behavioral sciences are the techniques which are actually qualitative method. So you just have to know, since exam is very near, just know these names. Pokemon. बाकी सब क्या है? Quantitative. तो देखो, tell me the answer to this. A method which compares benefits of a program without taking into account the cost of the program. So it covers benefits of the program, but it's not considering the cost of the program. So what is it? Like it's not, it's in non-monetary terms basically. Bache, it is not accounting for the cost. So what would you do? It's giving you the outcome in non-monetary terms. It's giving you the outcome in non-monetary terms, guys. Cost effective. Like purpose of a health program is to save lives. Number of lives saved, number of heart attacks avoided. Most comprehensive indicator of cost effective analysis is most comprehensive indicator. All right, most comprehensive indicator of cost effective analysis, everybody, is quali gained. ठीक है, quali gained. That's the most comprehensive indicator of cost effective analysis. Cost benefit is when we look at the outcome in monetary terms. Number of monies, like you know how much money was saved. कॉस्ट अकाउंटिंग होता है कॉस्ट स्ट्रक्चर, कितना रेकरिंग कॉस्ट्स है, नॉन रेकरिंग कॉस्ट्स है. ठीक है. इनपुट आउटपुट इज, इनपुट कुड बी मैन पावर, मनी, मटीरियल. आउटपुट अगेन इज लाइफ सेव्ड, हार्ट अटैक्स अवॉइडेड. सो आई मेड द स्मॉल टेबल फॉर यू, यू कैन गो थ्रू इट. देखो, कॉस्ट बेनिफिट में आपका जो इनपुट है वो कॉस्ट है, आउटपुट भी तुम्हारा क्या है, कॉस्ट है, मॉनेटरी टर्म्स. कॉस्ट इफेक्टिव में इनपुट कॉस्ट है, बट आउटपुट वी आर नॉट लुकिंग इन टर्म्स ऑफ मनी, इट्स द लाइफ सेव्ड, हार्ट अटैक्स अवॉइडेड. कॉस्ट यूटिलिटी एनालिसिस वी डू फॉर इंटरवेंशंस, जो क्वाली में पढ़ा था हमने. ठीक है. इंटरवेंशंस के लिए वी कैलकुलेट कॉस्ट यूटिलिटी. कॉस्ट अकाउंटिंग, कॉस्ट स्ट्रक्चर ऑफ अ प्रोग्राम. सिस्टम एनालिसिस इज what is the best alternative based on cost effectiveness. Work sampling, we will observe the work of medical officers, you know, lab technicians and nurses, and see कि वो कहाँ काम कर रहे हैं, कहाँ नहीं कर रहे हैं. Network I will teach you right now, PERT and CPM. ठीक है. So you should know this chart. So try this question, guys. This can come for your NEET also. In a hospital, the management unit wants to know how much time each doctor is spending with the patient on an average. In order to improve the quality of care, they want to increase or decrease the number of doctors as per the requirement. Good. This is work sampling. ठीक है. Work sampling is systematic observation and recording of activities of doctors, nurses, and then accordingly tell them where they are lacking to improve their roles. Decision making is a quantitative technique. भूलना नहीं, decision making is a quantitative technique. चला दो. All right, decision making is a quantitative technique. Decision making is a quantitative technique, everybody. Now, what is this image? Can you tell me what does this image represents? Anybody? Can you tell me what does this image represents? This image is actually an image of network analysis. किसका इमेज है? नेटवर्क एनालिसिस. नेटवर्क एनालिसिस में हम लोग क्या करते हैं? It's a graphical image telling us what activities are to be done to complete a objective. This is of two types. Like you have two things over here, PERT and CPM. PERT होता है प्रोग्राम एवेल्युएशन रिव्यू टेक्निक, CPM होता है क्रिटिकल पाथ मेथड. सो PERT इज you arrange all the activities in an order. It is event sequencing. सारे events को तुम order में लगा दो कि पहले ये होगा, first we'll do this, then we'll do this, then we'll do this. CPM is what do we do? Event time sequencing. We calculate the time that each event is going to take and the path with the longest duration. All right, longest duration path. जो पाथ है जो कि लॉन्गेस्ट ड्यूरेशन है उसको हम लोग क्या बोलते हैं एवरीवन? वी कॉल इट एज क्रिटिकल पाथ मेथड. द पाथ विथ लॉन्गेस्ट ड्यूरेशन गाइज इज क्रिटिकल पाथ मेथड. ठीक है? ऑलराइट, एवरीबडी, डिड यू अंडरस्टैंड? अब देखो इसमें like you have all the set of activities. If somebody asks you which is the critical path over here, so here you can see 10 to 30, 3 months and 4 months, and you will calculate यहाँ से यहाँ जाने में 5 months लग रहा है. ठीक है? यहाँ से 6 months लग रहा है. ठीक है? यहाँ से 4, 5, 6, 7. So this route is taking 7 months. So this one is what? Your critical path in this image. All right, ठीक है? So critical path आ सकता है एग्जाम में. It is the path which is going to take the longest duration. You have to calculate and you have to see. They can give you an image and they'll ask you which one is taking the longest duration. Okay? Alright, let's talk about a little of international health. Now international health we've covered in image based session also, but I'm just going to discuss with you a couple of questions and the logos, guys. So tell me answer to this. As per SDG, the target of MMR is, we're not taking too much time here, less than 70 per 1 lakh live birth. Sustainable development goal was developed by United Nations. This is the logo. ये देखो, United Nations. And also UNDP. UNDP is a part of United Nations. Next time they can give you SDG के according neonatal mortality rate we have to decrease to 12 per 1000 live births. Under 5 to 25. Under 5 to 25 per 1000 live birth. One more value you should remember for SDG: reduce premature mortality due to NCDs. Reduce premature mortality due to NCDs by 33%. Okay, by 33%. कभी एग्जाम में ये क्वेश्चन आ गया था. ठीक है? 17 goals, 169 targets. Direct health related goal is goal number 3. All this has been discussed before as well. What is the answer to this? Applied nutrition program. Applied nutrition program. Which of the following agency provides seed and manure in applied nutrition program? Yeah, this is UNICEF. UNICEF. CARE is helping out in everything, family planning, nutrition, everything. But applied nutrition program was particularly by UNICEF. UNDP and UN, they came up with your SDG. Cobalt therapy units are set up in which plan? Cobalt therapy units were set up in which plan? Yeah, I will discuss the logo. Give me 1 second. Colombo plan. Very good. Now tell me a question about this. All are true about Rockefeller Foundation. I think maybe Rockefeller aa jaye. So what I did is, from the textbook of Park only, all the points that are there for Rockefeller, I am discussing it here. The headquarters is in Geneva. All the foundations have their headquarters in Geneva. Okay, established in 1913. Is it in Geneva? Work in India began in 1920. Now the foundations don't have their headquarter in Geneva. Rockefeller Foundation, Ford Foundations, they have their headquarter in New York. Rockefeller, I wanted you to see this. They work to control hookworm disease in Madras, and also there's a very famous institute for MD PSM as well in Kolkata, which is All India Institute of Hygiene and Public Health. They have also developed that institute. Okay, which organization offers disaster management service? Disaster war victims को कौन सा organization help करता है guys? Disaster and war victims can turn up in your exam. Disaster and war victims को which one is helping? Good, it is International Red Cross. Disaster को भी, war victims को भी. Who is helping? International Red Cross. Okay. Now these are, this is a chart where you can read what each one is doing. I have shared this before also guys. ठीक है, applied nutrition program, you can go through it. I want you to specially focus on United Nations, UNDP, they framed SDG, also Human Development Index. ठीक है, UNICEF, GOBI, FFF, that you must know. FAO, we have discussed many times, food, forest, fisheries, USAID, World Bank financially, Ford Foundation, ये वाला चार्ट LRR में भी है. So you can go through these chart what they are doing. सीडा का देख लो, TB है, Taneja, blindness है. Care is helping in a lot of things, family planning, nutrition, a lot of things. It's helping overall health में care help करता है. ठीक है, सो एक दो चीज़ें याद रखनी है. ऑफ कोर्स दीज लोगोज यू हैव डन इट मेनी टाइम्स विद मी. WHO, द हेडक्वार्टर इज इन जिनेवा. UNDP and UN, all organizations that start with the UN have their headquarter in New York. There's one exception however. This is World Bank. World Bank का headquarter कहाँ है? Washington. World Bank has its headquarter in Washington. फैमिली प्लानिंग UNFPA, ये भी क्वेश्चन है. पॉपुलेशन कंट्रोल UN से स्टार्ट होता है, न्यूयॉर्क. दिस वन गाइज यूनिसेफ, न्यूयॉर्क. ओके, UN न्यूयॉर्क. FAO, फूड एग्रीकल्चरल, खाना खाने कहाँ जाना है? रोम जाना है. ILO लेबर हेडक्वार्टर आ सकता है जिनेवा. दिस वन इज UNAIDS. UNAIDS इज द ओनली वन दैट स्टार्ट्स विद द UN बट इट्स हेडक्वार्टर इज इन जिनेवा. That's the only thing. International Red Cross. International Red Cross, again it's in Geneva. This is Suraksha Clinic, initiative of NACP. ठीक है, Suraksha Clinic I have discussed in the program also. Both these foundations guys have their headquarter in New York. Care, cooperative for assistance and relief everywhere. This again has its in Geneva. सीडा स्वीडन हो गया. कोलंबो प्लान कोलंबो हो गया. डैनेडा तुम्हारा डैनिश हो गया. क्लियर? सो यू मस्ट नो अ कपल ऑफ दीज क्वेश्चंस व्हिच कुड कम इन योर एग्जाम्स. ओके, ऑलराइट, मूविंग अहेड, लेट्स सी इफ यू कैन डू दिस वन. जस्ट अ सेकंड. Okay, now we're going to talk about your और blindness national जो India blindness program है. Okay, the logo is like this, Indian blindness program, and you have this thing, national logo for blindness control program. ये पीछे का sign is actually reflecting Canada. Okay, D को B बना दो. Now how is broken vaccine vial disposed? Broken, it's a glassware. ठीक है, अगर VV आया, वैक्सीन वाइल आया, broken VV आया, they are all going to go into blue. But if the vaccine vial has vaccine in it, then it is going to go into the yellow bag, like I've taught you before also. Okay, so again you can go through this table guys. Yellow bag is anatomical waste, human anatomical any body fluid, मतलब कुछ भी contaminated हो गया, expired discarded medicines हो गया. Blood bags very important over here. ठीक है, mask हो गया. Vacutainers with blood also go in yellow bag. Vacutainers with blood go in yellow bag. Vaccine with vaccines, vaccine vials with vaccine, they go go in yellow bag. Red bag is like RPT, recyclables, plastic tubes. So any tubes, catheters, urine bags, very important, it has the letter R in it. Syringes without needles go in red bag. With needles they go in white bags. Gloves will always go in red bag. ठीक है. Blue, very important, glasswares हो गया. Okay, and if you talk about metallic implants, artificial pacemakers, question आया हुआ है, they go in blue color bag. Okay, so you have to remember, yeah, of course, like look at this NEETPG 2021 question. What are you going to mark over here? A child presented to OPD with pharyngitis, a throat swab was obtained and sent for culture. In which of the following is the used swab? Now anything which is coming in contact with your body, contaminated with body fluids, they have to go in yellow color bag. ठीक है, they have to go in yellow color bag. Following admission of RTA, there is spillage of blood all over the hospital. Which disinfectant? Chloride compounds, right? So which disinfectant you will use over here? Sodium hypochlorite. Depending on the amount of blood, it can go from 1% to 10% also. But please remember, in case of mercury spill, you will not use sodium hypochlorite. What do? You wear your PPE, you switch off all the fans, you remove anything metallic from your body, then you will use 2 cardboard pieces, alright, use 2 cardboard pieces or X-ray films to collect mercury. You will collect mercury and drop in a tube, okay, drop in a tube filled with water, okay, half at least filled with water. Send back to manufacturer. It has to be sent back to manufacturer. But please remember, you have to clean the floor with. What will you clean floor? Sodium hypochlorite? No. Sodium thiosulfate. Don't forget this. Don't say hypochlorite. ठीक है? Sodium thiosulfate से साफ करना. Okay, now last thing, occupational health. Maximum work hours per week including overtime according to Factories Act 1948. Now since it's saying overtime, it is how much? 60 hours. Without overtime it is 48 hours. ठीक है, और 48 hours, that means 9 hours per day. 60 hours में क्या उतना हो गया? 12 hours per day. ऐसे भी पूछ सकते हैं. Okay, this you all should know about Factories Act. No child below 14 years should be employed according to Article 24, and appropriate work of children of tender age 15 to 19 years according to Article 39. ये क्वेश्चन भी आया हुआ है. 500 क्यूबिक फीट स्पेस पर वर्कर को मिलना चाहिए. इफ़ यू हैव, यहाँ पे 50 कर दो, मोर देन 50 वर्कर्स वी विल ओपन अ क्रैश. क्रैश इज अ डे केयर फैसिलिटी. मोर देन 250 वर्कर्स वी गोइंग टू ओपन अ कैंटीन. मोर देन 500 वर्कर्स वी विल ओपन अ वेलफेयर ऑफिसर. ओके, वेलफेयर पे ध्यान देना बहुत ज़रूरी है. सो वेलफेयर ऑफिसर. मोर देन 1000 वर्कर्स वी विल ओपन अ, ठीक है, वी विल सेफ्टी ऑफिसर. ओके, क्लियर, good. Now for an employee diagnosed with TB, extended sickness benefit, of course the benefits form an important part of your exam. So extended sickness benefit is 1 year, 2 year, 3 year, 4 year. Extended sickness benefit is for 2 years. Alright, and this is given at, so you can just read over here, extended sickness benefit is given for a period of 2 years. It is given at 80% of wages for 2 years. It covers 34 specific diseases. Question अभी तक TB पे आता है, but next time they can give you certain examples which I feel they might write. कभी लेप्रोसी दे सकते हैं, डायबिटीज़, ग्लोकोमा, CAD, पार्किंसंस के लिए भी दिया जाता है, पैरालिसिस, something like that, you get it. ESI Act, please remember, if you talk about ESI Act, I have revised this in image-based sessions also. ESI Act में the employer's contribution is 3.25%. and employees contribution, everybody 0.75%. But if the employee is disabled, then they don't need to give any contribution for 3 years in case of disabled people. And benefits will be given to ESI employee who earns up to ESI employee earning up to rupees 21,000 per month. But in case of disability, guys, in case of disability, this benefit will also be given to an employee who earns up to rupees 25,000 per month. ठीक है? So yeah, yes, I have already written. You can go through this. This is the logo of it, and it covers all factories excluding रेलवेज. रेलवेज इसमें नहीं आता है, डिफेंस नहीं आता है, माइंस नहीं आता है. Excludes railways, defense and mines, and of course it's going to employ 10 or more persons to call it as a factory. Okay, patient presents to SI hospital for treatment under the SI Act. कौन सा benefit लेगा? Sickness benefit? Treatment के लिए which benefit, guys? Is it sickness benefit? फटाफट sickness मत मार्क करना. मेडिकल केयर के लिए जाते हो ना, मेडिकल बेनिफिट. ट्रीटमेंट में तुम sickness benefit नहीं लोगे. आप क्या लोगे for treatment? You're going to take medical benefit. Medical benefit is direct medical benefit and indirect medical benefit. Direct medical benefit is via the ESI hospitals, and if you talk about indirect medical benefits, it's via the empaneled hospitals. Okay, and you must remember this is a cashless benefit. Cashless benefit. सिकनेस बेनिफिट अलग चीज होती है. सिकनेस बेनिफिट रोहित होती है. Look, sickness benefit is something that you can take for for 91 days. All right. 70% of wages पे you're going to get it. ठीक है, but you should have worked for at least 78 days for 6 months at least. Extended sickness benefit, we just discussed 34 diseases, TB and all that. 80% up to 2 years. Enhanced sickness benefit, vasectomy, tubectomy, full wages. Maternity benefit, 26 weeks, full wages. पूरा कोई पैसा कट नहीं होगा. Can be availed 8 weeks prior to delivery. MTP 6 weeks. ठीक है, प्रेगनेंसी कन्फाइनमेंट 4 वीक्स. टेम्पररी डिसेबलमेंट 90% वेजेस टिल रिकवरी. परमानेंट 90% कम से कम. डिपेंडेंस बेनिफिट इज एट 90% वेजेस. एंड ऑफ कोर्स फ्यूनरल एक्सपेंसेस ₹50,000. ठीक है, वेसेक्टमी फॉर 7 days and for a woman tubectomy 14 days. This I think we've already discussed. Okay, can you tell me the answer to this? A 55-year-old male who was working in the dye industry, exposure to aniline dye, presence with bladder carcinoma. Yes, bladder का सबसे common cause ही है transitional cell carcinoma, and it presents with what? It presents with painless hematuria. Dye, naphthalene dyes. Okay, so that you should remember. So this you can just read. I have written over here कौन से डाइज है. ऑरमीन, मेजेंटा डाइज. सिगरेट स्मोकिंग यहाँ मेन इटियोलॉजिकल फैक्टर होता है फॉर टीसीसी. यूरिन एग्जामिनेशन पहली चीज़ कराओगे. एंड ऑफ कोर्स फॉर ट्रांजिशनल सेल कार्सिनोमा दिस यू मस्ट हैव बीन टॉट इन सर्जरी, बट रिमेंबर दिस एज वेल. सिस्टोसोमा हेमाटोबियम लीड्स टू इट, एंड कैंसर ड्रग में साइक्लोफॉस्फेमाइड इज ऑल्सो रिस्पॉन्सिबल. ठीक है. Okay, transitional cell or squamous cell. So you should know the difference between that. Now from this chart, look at this. Benzene is leukemia. What I'm circling, you will read. Benzidine is bladder. D for bladder. Benzidine is bladder. Benzene is leukemia. Okay, everyone. Vinyl chloride, of course, is liver. Wood dust, this is nasal sinus. ठीक है. मोस्ट कॉमन ऑक्यूपेशनल कैंसर क्या है? सबसे कॉमन ऑक्यूपेशनल कैंसर, एवरीबडी, मोस्ट कॉमन ऑक्यूपेशनल कैंसर इज स्किन कैंसर, स्क्वामस सेल कार्सिनोमा. प्लीज डोंट से लंग कैंसर, इट इज स्किन कैंसर. Okay, these are risk of pneumoconiosis which you should study. I have shown in LRR also. Sandstone, ceramic, pottery, construction works. In all this you have silicosis. सीमेंट फैक्ट्री बहुत इंपॉर्टेंट है गाइस. एस्बेस्टोसिस. coal mines is anthracosis. Coal mine anthracosis. Photography printing barretosis. Textile vicinosis. 5 minutes. Textile industry vicinosis. If you talk about cane sugar factories, this is what bagasosis. ठीक है? Agricultural industry farmers lung. Grain dust moldy है. Farmers lung. Grain dust moldy है. Clear? Is it clear everybody? So इस पे ध्यान देना, एग्जाम में ये क्वेश्चन आता है. And what I've done is, this is a go-to slide guys. All the commonly asked questions, जैसे silicosis में पूछता है what is associated TB, silico TB is associated. In silicosis it's upper part of the lung affected. Snowstorm appearance, nodular fibrosis, it's written over here. Asbestosis, B से basal part of the lung affected. Most common is adenocarcinoma. Specific mesothelioma है, ground glass appearance, so you can read it. Anthracosis, coal miners disease. ठीक है? Anthracosis is reversible guys till the time it presents with progressive massive till it presents with simple coal workers pneumoconiosis. Once it has progressive massive fibrosis, ये क्या हो जाएगा? Irreversible. Bagasosis non-notifiable. ठीक है? Non-notifiable is bagasosis. Okay. Alright, then you should also know farmers lung, grain dust, moldy है, micropolyspora fini, तो ये तुम यहाँ से revise कर सकते हो. चलो, yeah, just a couple of more questions. Can you quickly tell me the answer to this guys? A 50-year-old male presents to medicine OPD complaining of shortness of breath. He gave a history of working in sandblasting industry. Chest X-ray reveals PMF. PMF मतलब क्या है? Progressive massive fibrosis and chest sand blasting. Very good. Sand blasting. Progressive massive fibrosis sand blasting industry में भी I mean silicosis में भी हो सकता है. Anthracosis also you can see. Anthracosis you can also present with black lungs. Okay. Last thing. Tell me the phases of this one guys. Which is this phase? Formation is marriage to birth of first child. This is family cycle. Extension क्या होता है? Birth of first child to birth of last child. Complete extension, birth of last child to first child leaves home. Contraction, first child leaves home to last child leaves home. Complete contraction, last child leaves home to first spouse dies, and dissolution. Suppose exam में question आया, birth of last child, which phase? What is your answer? Birth of last child is which phase? What is your answer guys? Birth of last child is which phase everybody? Suppose exam में question आता है birth of last child, which phase? Yes, always go by this beginning. ठीक है? So birth of last child is showing in which one? Complete extension. Okay, all right. What is this called? Study of human relationships and human behavior. Study of human relationships and human behavior is sociology. Definitions आ सकते हैं. Group of individuals leading a certain way of life, sharing common values and interests is society. A society within a geographical boundary is community. Just society with a geographical boundary. Pattern of interrelationships among members in a society is social structure. Social structure. Process by which individuals adopt the culture and become part of the society, socialization. Studying social causes leading to occurrence, social pathology. Exchange of cultures guys, acculturation. Learned pattern of behavior is culture and established pattern is customs. Okay, so just wanted to revise these couple of definitions which you must do for your exams. Opinions हमेशा temporary subjective होता है. Permanent belief होता है. More or less permanent objective in nature, attitude. Type of learning में I want you to focus on psychomotor learning guys. skill based learning. Most common emotion fear, then we have love. But one question that came guys, 3 groups जिसको आप temporary groups बोलते हो. Temporary groups are crowd, mob, herd. जैसे tourist guide is actually a herd. Crowd क्या होता है? There's no leader. Out of anxiety, out of curiosity, we have collected. Mob is a leader with emotional component attached. Herd क्या होता है? There is no emotional attachment as such in a herd. Okay, you have a leader. Crowd में there is no leader. Mob में you have a leader with emotion. Herd में there is a leader without any emotion. So remember that. Last slide of the day. Now these are just barriers of communication. इसमें से एक चीज़ देख लो जो कि सबसे important है. Suppose customs and beliefs, like a person is not getting the child vaccinated because he fears impotency. Example, not vaccinating, fear of impotency. Not vaccinating, there's fear of impotency. So what is it that we are addressing over here? We are addressing cultural barrier over here. Just focus on these 1 or 2 questions which could come in your exam. Okay, so that's it. I've just tried to give you an overview of all the remaining topics. Guys, please don't be worried too much. ठीक है, सब आपको याद है. We will meet for numerical based session day after tomorrow, not tomorrow, on Monday. Okay, on Monday. So again I am saying LRR को revise करना if you are running very short of time. It has everything guys. These Sure Shot sessions were meant to keep you on track. There is an image PDF, there is an image based session on Prepladiv YouTube. इसको और इसको पक्का से करना है guys. Sure Shot of course it's keeping on track, keeping you with MCQ practice, not letting you out of this one. प्रतीक्षा, India's current MMR is maternal mortality ratio is 93 per 1 lakh live births. SDG wants us to achieve 70, below 70 per 1 lakh live births. Did you understand the difference? Okay. Okay, why doesn't see dissolution is when. See, if you talk about the family cycle, no, if you talk about dissolution is first spouse dies and death of survivor. Now last child has left home and the first spouse is not yet dead. It is complete contraction. If she dies, dissolution. Okay, so that's it for today. Thank you so much. First question क्या था? First question तो phases था ना disaster cycle का. Just follow this image dear. What is the phases? Impact, response, recovery, rehab. Response, recovery, rehab, reconstruction. ये phases before disaster होता है. Your cycle starts after impact. Is it clear, everybody? चलो. So thank you so much. I'll see you again soon. Measles वाला question ये था that where is it? Yeah, see, in disaster endemic zones, health workers को we can give all the vaccines except measles, because measles is given to only in children. For health professionals, you will give all the vaccines to the health professionals. Measles you don't need to give, it's given to children. Post disaster guys, victims में सारे vaccines contraindicated है except measles, that too in children, because seroconversion rate of measles vaccine is faster. Antibodies form within 3 days of exposure. देखो हिंदी में बताती हूँ. डिज़ास्टर के बाद GI इन्फेक्शन बहुत कॉमन होते हैं, ठीक है. तो जो भी विक्टिम है उसका मतलब ये नहीं है कि उनको टाइफाइड कॉलरा लगा देंगे, नहीं. डिज़ास्टर के बाद विक्टिम्स को सिर्फ एक वैक्सीन लगाते हैं, मीजल्स, वो भी बच्चों को लगाते हैं. क्यों लगाते हैं मीजल्स? क्योंकि उसका सीरो कन्वर्जन रेट फास्टर है. मतलब मीजल्स का नेचुरल इंक्यूबेशन पीरियड 10 to 14 डेज है और वैक्सीन लगाने के बाद एंटीबॉडी 7 to 10 डेज में बन जाता है. तो क्योंकि एंटीबॉडीज सिम्टम्स आने के पहले बन जाते हैं तो हम वैक्सीन दे देते हैं, बट वो भी सिर्फ बच्चों को, बड़ों में मीजल्स होता नहीं. WHO एक और चीज़ क्या कहता है कि डिज़ास्टर एंडेमिक जोन्स में जो हेल्थ प्रोफेशनल्स वर्क करते हैं उनको सेफ रखो, उनकी बॉडी में एंटीबॉडीज़ बने होने चाहिए टाइफॉइड, कॉलरा, हेपेटाइटिस ये सब को लेके। मीजल ज़रूरत नहीं है क्योंकि अडल्ट में होता नहीं है। इज इट क्लियर? अब समझ में आया सबको? चलो, yes, mitigation is before. Of course with measles vaccines you can give vitamin A. क्यों नहीं दे सकते हो? Because vitamin A क्या करेगा? malnutrition को prevent करेगा. Alright, so I'll see you tomorrow. Bye bye. Thank you so